Some of the other top health stories that we're following this week. Chief Medical Officer and Gynecologist Dr. Jessica Shepard is here to give us all the details. Dr. Shepard, thank you so much for joining us. We appreciate it.
Good to see you, Whit.
So let's start with the rising numbers of flu cases. The CDC data showing that doctors' visits for flu illnesses are at their highest levels in 15 years. I can tell you my daughter had the flu this week. It seems like every kid at her school is sick. What do we know about what's driving these cases, and is it too late to get a flu shot?
Well, let's start first with it's never too late to get the flu shot because as we have seen, these numbers are increasing, but that means that your susceptibility to getting the flu is very high. And exactly as we're saying, when we look at respiratory illness, it's not atypical to have seasons where we have what we call a very high nationwide type of activity. And even when we look at the different states, there's 12 states that are categorized as very high and 19 are listed as high. So the most important part is what can I do offset my chances of getting the flu, which include decreasing your sick contact, making sure if you do have the flu to stay away from other people, and again, looking at getting that flu shot.
So now to the bird flu, there have been no cases of human-to-human spread. Health experts say that the risk to the general public is very low, but we're still seeing this massive impact at the grocery store on things like eggs. What do people need to know about their own risk factors?
Yeah, that risk of getting what we call avian flu or bird flu is relatively low, but we do know in January in Louisiana, actually, that they had a patient who was hospitalized and actually died. So looking at making sure that we keep ourselves safe, I think the most important part during any flu season, no matter what variant or type it is to make sure that we're keeping ourselves safe by contact and washing our hands. That really is the best way that we can do that. Again, respiratory illness is spread through cough, and making sure that you keep away from people if you think you're sick.
Another topic I'd like to ask you about, too, because according to a new study by JAMA Pediatrics, teenagers, they're spending an average of 90 minutes a day on their phones in school. So this has become a huge problem for school districts. How can teachers and parents help teenagers find that right balance?
Yeah, even though when they looked at that time, it wasn't a time that was spent solely for that amount of time. It's when you check here and there, looking at the time, looking at a text that came in, and that really adds up. Now, what that really contributes to is distraction from the actual thing that's going on in school, which should be learning. And so I think this is what we're seeing in school districts, is that it needs to be a collective group that's working towards how can we decrease this kind of device looking. So from the school district, but also parents realizing that keeping these devices out of the classroom is going to improve the ability for students to stay focused during the school day.
And doctors, we've also been talking about some of these changes in Washington, the reshaping of the federal government. We're also getting this stark warning from the UN saying 6 million people could die from HIV and AIDS if U.S. funding stops under the potential foreign aid freeze. So what could be the potential global impact here?
Yeah, when we think about what this means between the U.S. and global health, is that we do contribute so much aid to what's going on in the rest of the world. So one, that's going to impact how the rest of the world either recovers or prevents any health illnesses or deaths and diseases. But the other important part of that is that actually contributes to research that impacts everyone, including us in the U.S. So when we look at that 90-day review of what they're looking at with foreign aid and the freeze, that's where we're going to see a little bit of turbulence or turmoil in these countries that really, really thrive on the foreign aid program, and having to disrupt rather some of the research and also the treatments that are going on currently in different areas of the world.
Okay, something to watch very closely. Chief Medical Officer of HERS and gynecologist Dr. Jessica Shepard, thank you so much for your time. We always appreciate it.
Thanks, Whit.